Good morning, and thank you for joining us. I'd like to start off by just saying thank you to all of those out there who stayed home over the weekend. With the good weather and the holidays, it must have been hard, so your effort is appreciated and certainly part of what will ensure our success overall in this effort. I'd like to now have a brief update on our cases, and after I get done with this, I will introduce Dr. Patrick Ludke, our Senior Public Health Officer, who will talk a little bit more about the modeling. You've probably seen the news from Oregon Health Authority this weekend that talked about some updated insights into our situation. To date, we have 42 positive cases here in Lane County that we know about. Also, 1,356 tests have come from Lane County to our area labs, again, that we know about. Of those, we have 6 individuals who are currently hospitalized. We have 12 individuals who have completely recovered. Again, that recovery is defined as 72 hours without a fever or without a cough and without the aid of medication to achieve that. We are still holding at 1 fatality, and we have 23 individuals who are recovering at home but still sick. So the last time that we spoke, we had 35 cases, so we're going to go through 7 cases and the details around these. Some of them are a little bit more complex, and you're going to notice a difference in the detail that we share. That is to ensure that we can maintain the anonymity of the individual while providing the important pieces of information that we feel the community should have. Our 36th case was an employee of River Grove Memory Care Facility. This individual has had at least 4 contacts. Each one of those contacts is currently being tested. We'd also like to say thank you to River Grove Memory Care Facility. They have been very proactive in their efforts and have worked with us and are following all Lane County Public Health guidance. So a great partner in River Grove. Our 37th case was a female in her 40s. She is from rural Lane County. She's only had personal contacts and is medically stable and recovering at home. Our 38th case had access to Good Samaritan facilities. That is a retirement and care facility, has multiple different components to it. That individual is at home and stable. This individual potentially had multiple contacts, and we are currently doing our investigation process to identify those and follow up with those. Our 39th is an employee of Garden Way retirement home here in Eugene Springfield area. This person also resides in Eugene Springfield. Contact investigations are underway to identify those potential exposures. Our 40th case is a female in her 70s. She is from the Eugene Springfield area. She is medically stable and recovering at home. She's also lives at a private residence. Our 41st case is a male in his 20s from the Eugene Springfield area, medically stable and is recovering at home. Our 42nd case is a female in her 40s from the Eugene Springfield area, medically stable at home, and again from a private residence. We feel it necessary to go ahead and try to identify that detail where possible, just to be able to delineate whether or not we're talking about someone from a long-term care facility or someone from a private residence. The last announcements that I will make before I introduce Dr. Patrick Ludke is that the Oregon Department of Agriculture is now taking complaints regarding social distancing, physical distancing at grocery stores. They're doing this through email, and so that email address can be found at our website, our coronavirus website, which again is lanecounty.or.gov/coronavirus. Once you get to the website, you'll see business information as a tab there. Click on that and you'll find that website to the Oregon Department of Agriculture where you can submit your complaints regarding physical distancing not happening at grocery stores. So finally, before I introduce Dr. Patrick Ludke, I will say that it's very visible where we see problems with physical distancing, problems with people not observing certain aspects of that. But overall, we believe that the majority of the people in Lane County are following physical distancing guidelines. And we're going to go ahead and encourage people to continue that as much as possible. That really is key in our ability to regain life as normal or some semblance of normalcy. And so your effort on that is greatly appreciated. And now I'll introduce Dr. Patrick Ludke, our Senior Public Health Officer.
Thank you, Jason. Today I'd like to discuss something that we've been nudged to discuss, which is essentially what does it look like to have this restriction, relaxation occur? What does the end look like? And I'm not convinced my crystal ball is better than anyone else's, but many of us are talking about how it could look if we were able to partially return back to normal. And I think from a standpoint of public health and health in general, there are several items that we would like to see before we start thinking that we could relax any of the restrictions that are in place. The first would be that diseases, either infections or deaths, decrease over the course of 2 incubation periods. The incubation period for this virus is up to 14 days. That's the length of time from when someone is exposed until they become symptomatic. So 2 incubation periods would be 28 days. And those of you who've been watching the numbers very closely know that we've kind of hit a relatively stable period, a couple cases a day, sort of a plateau, and we hope to stay there and then slowly decrease. So we're certainly not where we would be to say cases are decreasing over 2 incubation periods. But that's a key item to look at for us as we go forward. The second item is we really need local testing capacity. Our response, as Jason just showed, involves finding cases and doing contact investigations. That's a critical part of any outbreak response. And we need to make sure that we have testing capacity locally that allows us to do that very quickly. Not just to respond currently, but if we were to relax restrictions and a second wave occurred, we would need to scale back up very quickly to make sure the second wave wasn't too big. So we don't have enough local testing capacity. I think everyone knows that. We're slowly increasing that testing capacity, but we really will look at that before we consider relaxing some restrictions. The third item is contact tracing resources. We're pretty good here in Lane County, but we're just one of 36 counties in Oregon. Some other counties have smaller health departments. There's a lot of travel and commerce between those health departments and between those communities. We need to make sure everyone has the ability to do contact tracing in a real-time sort of way. The fourth item would be sufficient PPE, or personal protective equipment. And I suspect many of you are aware that there have been national shortages in many areas and local shortages as well in the state of Oregon. We are getting more PPE available in the pipeline, but we really need to make sure that there is significant PPE before we consider relaxing any of these restrictions. Next is a general blueprint for the public. So what would it look like as we relax restrictions? This is something relatively new, I think, to many of you in the community. And we need to have a blueprint and then education of the business community and the general public before we consider moving forward in that regard. Number 6 is plans for our healthcare community colleagues to scale back up if there were a second wave. We've been working very closely with hospitals and urgent care and with the other clinical entities in the community, from behavioral health to dentists to primary care. And we need to make sure that they're all ready to scale back up if we were to get a second wave, should we decide to relax these restrictions. And then finally, again, we're just one of 36 counties. We could be the lucky county that has many, many fewer cases, and it looks like they're decreasing significantly, but other counties around us are on the steep part of the curve going up. And it would be unwise for us to relax restrictions were that to happen. So we really need a statewide view, which means we need some alignment with the Oregon Health Authority. So for me, those are the 7 main criteria that I would like to see visioned and assessed appropriately before we were to consider relaxing these restrictions. I suspect that there are a few other criteria or nuances of these criteria from others in the public health space, but we will all be working together as we go forward to make sure that we are looking at an appropriate horizon to consider relaxing any restrictions. So I will stop there, and I believe we're going to move to questions. Is that right, Jason?
That's right.
Okay. I will leave this with you.
And now I'll take any questions from members of the media.
Angelina Dixon would like to know the number of recoveries.
So Angelina with KMTR would like to know how many recoveries we have had. So to date, we have 12 recoveries. Very thankful that we are tracking those, not only to celebrate the good news, but also to have a better sense of how long the illness lasts in our community. We can really get a lot of rich data from tracking that. So we've been doing that since the onset, looking at those recoveries. waiting while members of the media are feverishly typing. While we're waiting on some more questions to come in, I will comment just briefly. One piece that I forgot to mention earlier is around a special function of our emergency operations that specifically looks at long-term care facilities and skilled nursing facilities. And so obviously the recommendations for those facilities are different than most healthcare facilities. And we've had great communication with our long-term care facilities and really just trying to stay the course. We had anticipated there to be cases pop up within this population. I think we've been very fortunate up until this point, and now we're starting to see our first cases. This might be a turning point in terms of how we manage the emergency operations going forward, and really drilling down and putting a lot of effort into containing those cases at our long-term care facilities. And as Dr. Ludke mentioned, what part of that really is being able to, in a very efficient and expeditious way, test individuals who might have been exposed and then cordon them off within the facility. And so it is very fortunate that we've been able to have that time to sort of get the plans in place and be able to react to some of these. The other part that we're doing very actively throughout this process is looking back at that contact tracing, or what is being called contact tracing, looking at how did the cases actually come into these long-term care facilities. And that'll help us better understand what kind of recommendations we need going forward. And we have a couple questions for Dr. Ludke, so I will re-clean the podium and he can come right back up. We appreciate your patience.
So I think that's a very interesting question. Many of us in public health epidemiology really find the contact tracing part of it fascinating. So early on in this outbreak, the vast majority of our cases were linked to travel. So we had cruise ships, we had people coming in from other countries who had outbreaks ongoing. And now we're down to less than 20%. In fact, I think less than 10% of those cases coming directly from travel. So there's really been a shift. And what that means, of course, is not just that traveling has decreased because of some of these restrictions put on travel, but also we now have community transmission. So now the cases we're getting are from people traveling within Lane County for the most part. So a significant change from the first few weeks of this outbreak until now.
Rachel from KLCC would like to know whether there is a potential for retroactive testing.
Retroactive testing. So I'm going to take that to mean someone who was symptomatic in the past and perhaps recovered, and then could we test them to say that maybe they were in fact infected back in February? So a nuanced yes. The yes would be that the testing that we have currently, the so-called PCR testing that actually picks up pieces of the virus in the human body, wouldn't pick up somebody who was infected a few months ago because your body has already cleared that virus, so there's nothing left. But antibody testing, which tests your body's response to an infection, would be able to pick it up because antibodies have a pretty long half-life. They live in your body for years. So those tests are just now coming on the market. So we are going to be using those tests to help understand what the outbreak was like and to get a better sense of how many people were infected in the first wave so we could better know how many people are susceptible in the second wave. So that's a long answer, and essentially the answer is yes.
And then it looks like our last question, Angelina with CAMSGAR would just like you to reiterate briefly what are some of those key things again that you're looking for a return to normal?
Well, I think while they're all important, really the key two entities or key items are that we really need to see a sustained decrease in cases over the course of roughly 2 incubation periods. And 2 incubation periods is 28 days. Each incubation period is 14. And the second is we need better testing capability locally. So if the cases were to ramp up, if we had a second wave, we could identify them very quickly, isolate and quarantine, and do our contact tracing appropriately. Those are the big two. The others I think are also important. Surely we need PPE, surely we need our clinical systems to be prepared for a second wave, but those first two are really important and we're just not there yet. Very good, thank you.